How to change Omnipod 5. How often to change Omnipod 5? How often to change Omnipod 5? The Omnipod 5 pod should be changed every 72 hours, 3 days, or when it runs out of insulin, whichever comes first. In certain cases, such as higher insulin usage, your healthcare provider may prescribe a 48-hour pod change frequency. This requires a clinical rationale and may involve using U200 insulin to accommodate the increased demand. The Omnipod 5 pod is designed to deliver insulin for up to 80 hours, including a 72-hour standard period and an additional 8 hours. However, it's important to note that the system will alert you when the pod is nearing expiration, and insulin delivery may cease once the pod expires. How to change Omnipod 5? Step 1. Prepare a new pod. Fill the pod with at least 85 units of insulin but no more than 200 units. Ensure the insulin is at room temperature and free of air bubbles. Step 2. Remove the old pod. Gently lift the edges of the adhesive tape from your skin and remove the pod slowly to avoid skin irritation. Clean the infusion site with soap and water or an adhesive remover. Dispose of the used pod according to local waste disposal regulations. Step 3. Apply the new pod. Select a new infusion site on your body, avoiding areas with scars or excessive hair. Follow the on-screen instructions in the Omnipod 5 app to apply the new pod. Step 4. Activate the new pod. Use the Omnipod 5 app to activate the new pod. Confirm that the pod is delivering insulin as expected.